You may be asking yourself, I am retiring, I'm past the age of 65, and I'm really wondering, am I going to be penalized for not having drug coverage through Medicare or a drug plan? And all my friends and all my family are telling me you're going to be penalized because of this situation. Here in just a minute, I'm going to cover exactly who gets penalized, who doesn't, and how we can help answer these questions for you. Stay around, be back in just a moment. So I'm going to walk you through just a handful of steps to ensure that you understand exactly what's going to happen when you retire, come off your employer plan if you're past the age of 65, and eliminate all this confusion that you may be hearing, and to eliminate you being penalized for anything, including your drug plan. So the first thing is keep it simple. If you're retiring 6 months from now, be prepared to enroll into your Medicare Part B or your Part A and Part B. If you're lost on how to enroll, you can either A, download a free guidebook that we provide below in the description, or you can call our office and just say, I'm confused, I don't know when to enroll, what do I do? Somebody said something about a guidebook. We can actually link you up with a licensed agent that walks you through the process. But the first important step is keeping things simple, being prepared 6 months out to enroll into your Medicare A and or B or both when it's about 3 months out from when you're going to be retiring from your employer plan. So that's the first most important thing. So number two thing to remember, what are credible coverage rules? So a person must not be without credible coverage for 63 days or more in a row anytime after they were first eligible for Medicare drug coverage to not be charged a late enrollment penalty. So a lot of times you'll hear me talk about these 63 days, this window of time. So if you're on a employer-based plan that's considered credible coverage, and most of the time your employer-based plans are considered credible coverage, or you can ask the HR department, is our plan considered credible coverage? So if I'm working past the age of 65, I do not want to be penalized. Then when you come off your employer-based plan, you're going to want to choose a drug plan or a Medicare Advantage plan that has a drug benefit in it within 63 days of your retirement. Now, like I said earlier, to keep it simple, in that first step, guess what? You actually enroll into Medicare A and B 3 months prior, and you can also, right around that same time frame, choose the health plan with the drug benefit to start on the day after your employer plan ends. So if your employer plan is going to end December 31st, your new plan will begin January 1st. I like to say at the strike of midnight, so there is no lapse in coverage. So that's very important for that second point. One of the things, just to remind you, if you don't have an understanding of how to enroll into Medicare A, B, A and or B, or just confused about the whole process, we have a guidebook that we provide you at no cost. It's linked below in the description, or you can call our office and get a copy of that guidebook. But look in the description, grab our guidebook on how to enroll into Medicare and just the easy steps. And we also give you scenarios that walks through different scenarios for each of you guys. But you specifically, if you're asking questions of how do I enroll, what about this? What about this situation, Kelby? What about this situation? We're going to walk you through those in the guidebook, or you'll pick the phone up and give us a call, set a time to talk to one of us that's a licensed guide to be able to walk you through answering those. So the third thing to remember is, what is the 8-month rule for Medicare? There's this 8-month rule that applies to you guys that have worked past the age of 65 that's going on to Medicare Part B. There's this 8-month rule that applies to you. I'm going to read this rule to you. So this rule gives you 8 months from the end of your employer coverage to enroll into Medicare Part B or medical insurance, and Part D, prescription drug insurance, without facing a late enrollment penalty. Now, do you have 63 days or 8 months on Part D penalties? This is kind of the fourth thing and one of the most key things to understand. A lot of times people will say, I have 8 months to enroll in my Medicare Part B. I've read that somewhere. And we go, yes, you do. Medicare gives you this time period of 8 months to enroll into your Medicare Part B. That means you can come off your employer-based plan, have Part A, not have Part B, and enroll up to 8 months. Now, 63 days after you lose your credible coverage for your drug coverage with your employer plan, that from that time period on, every month that you do not have credible coverage, you're going to be penalized 1% towards a national prescription plan premium average, which is about $35 a month, typically 35 cents a month, and it's going to accrue month after month. until your drug plan coverage begins. So if you choose to just stay on Part A and bump out to 8 months and enroll into your Part B and then choose a Part D plan, you're going to have 6 months worth of penalty there because you didn't have drug coverage. And it's just important to understand that when people talk about this 8-month window, we like to kind of throw that out the door. We like to say prepare early, 3 months prior, your coverage starts, or you have up to 63 days after your coverage ends to eliminate the penalty. So you have a shorter time window. All the rules and everything about Medicare applies to this 3 months prior or 63 days after. That's a simple way for you to understand how to eliminate penalties. So the key reminder is the 8-month rule gives you a grace period to enroll into Part B and to Part D, but you actually have a Part D penalty beyond the 63-day lapse of coverage if you so choose to do that. So it's just a key reminder to keep that in mind and not to forget. So the fifth thing is Part D penalty if you choose not to enroll. How do you calculate this? We have an in-depth deep dive into how drug plans work. You can check that out in the corner of this video. You can always look toward things that's talking about prescription drug plans on our YouTube or other content that we provide, but we have some in-depth deep dives in that. I'm going to go over something very simple for you to understand. It's going to be equated if you don't have drug coverage, you wait however many months, you're going to have a 1% towards the national Medicare prescription drug premium average for that year, which right now is roughly just a little less than 35 cents or $35. So you're going to have 1% of that is 35 cents times however many months you've gone without credible coverage drug benefits. So sometimes people come off an employer plan, they go on A and B, they pick up a supplement, or they may pick up a Medicare Advantage only without a drug benefits because they say, I'm healthy, I don't need a drug plan, I don't want to pay the co-pays. They don't realize what's happening is they may not take any medication for 5 years, then be prescribed a name brand medication, and then they're going to be penalized those 60 months that they went without drug coverage. So it's very important to make sure that you understand the penalties assessed because it can be quite expensive. We've seen people go 10 years and then all of a sudden they're on 2 name brand medications at several $100s a month each, and they have to choose a drug plan and they're assessed this penalty. The penalty will follow you for a lifetime. That penalty is not assessed by not assessed by us. It's not assessed by your health plan. It's a CMS regulated penalty, or the federal government assess this penalty onto you. So it's a way to penalize those. I always say if you're healthy, beware, because if you don't choose a drug plan, you're going to get assessed a penalty if you ever get sick. But it's important to understand that. If you guys would like to understand a little bit more about that 8-month rule, we have an 8-month rule guide below. So you're going to see how to enroll into Medicare guide below, and you're also going to see the guide book that's the 8-month rule guide book. I would encourage you guys to grab that. It explains it a little bit more in detail and gives you some links and things to be able to check out and understand that 8-month rule if you like to read and understand that, or just call our office. Learning all about the Part D drug coverage. If, again, you don't understand how drug benefits work, you can click on the link up in the corner. It's going to take you to our YouTube that's going to walk you through a deep dive of exactly how drug plans work. Guys, I hope this was encouraging to you. If you have additional questions that we did not answer, you can always reach out to us or always watch other additional benefits. If you're just entering into this age of turning 65 and you're very confused about Medicare, I would encourage you to enroll and get a free copy of our Medicare Made Simple workshops. It's provided a deep dive, any and everything about Medicare. It's about 40 or 45 minutes long. It comes with a guidebook and it provides a footprint of you to understand everything you need to know, or you can reach out to us, talk to us on the phone. We'd love to be able to help you enrolling into Medicare. As we like to say, we like to make your life easy by making Medicare simple. Until next time, I'll see you on the other side.